Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us for another segment. We're going to be speaking with Dr. Robert Giugliano. He's joining us to talk about some data that was released about an analysis evaluating patient-reported cognition in high-risk heart disease patients. Welcome to the program, Dr. Giugliano.
Yes, thank you for having me. Pleasure to be here.
A little bit of your background in the healthcare profession.
Sure. Well, I'm a cardiologist, and I practice at the Brigham and Women's Hospital in Boston. And that's really one of the three hats that I wear. I'd say about half my time I spend doing clinical trial research with a group called the TIMI Study Group that has led more than 60 large cardiovascular trials dating back to the mid-1980s. And then I also teach the residents and am involved in education at the medical school and beyond at other institutions.
Now, I said that we were going to talk about some data that was released from a specific study that analyzed or evaluating patient-reported cognition in high-risk heart disease patients. Now, first of all, who is a high-risk heart disease patient?
Sure. No, good question and good place to start. In this particular study, we were looking at patients who had a prior myocardial infarction, had a prior stroke, or had symptomatic peripheral arterial disease. So we knew that these patients had a history of atherosclerosis with, an important event having happened already.
How many of these types of patients were studied?
We had a large study here. This is a trial called the FOURIER study, which included over 27,000 patients in a number of countries throughout the world, including U.S., Canada, but also in South America, Europe, and Australasia.
So what was the main purpose of the study in these patients?
Right. So the main FOURIER trial was comparing the traditional therapies to lower cholesterol, and that was with a statin medication, versus the statin medication plus a newer therapy that's very potent to lower your LDL or bad cholesterol. Mm-hmm. And a newer therapy was an injectable medication. It's in the class of medicines called PCSK9 inhibitors, and this particular one was evolocumab, or it goes sold under the brand name Repatha. And the question was, well, if you add this newer, very potent medication and lower your LDL cholesterol even further, can you prevent future cardiovascular events compared to the standard, which is statin alone? Mm-hmm. That was the main trial, the FOURIER trial. Yeah. That was the main trial, FOURIER, and that showed that, lowering cholesterol even further with a PCSK9 inhibitor reduced your risk of future heart attack and stroke. Then in this particular study that we're discussing today, we were looking at the question of whether it's safe to do so or whether there would be any signals or signs of harm with regard to patient cognition, and that means patients' memory, or ability to make plans or be organized in their thinking. And that's a question that had been raised from prior studies in the field, both with PCSK9 inhibitors and with other cholesterol-lowering drugs. So it's an important one to answer for patients and for physicians to know, what is the effect on cognition with this medicine that dramatically lowers your cholesterol.
So what were some of the key findings?
Yes, importantly, there was no apparent effect on cognition with evolocumab in this study, and we used a particular type of questionnaire that's been used for many, many years in the field to actually have the patient complete a questionnaire at the end of the trial, asking 23 different questions about their memory, and then something called executive function. Executive functions are questions that have to do with your ability to plan, to organize, and whether you have trouble doing two tasks simultaneously.
Why use patient-reported methods during this analysis?
Yeah, great question. So this was one of the three approaches we used to ask this question of whether the drug was affecting patient cognition. So in prior reports, we had used something called adverse event reporting. In other words, did the physician caring for the patient notice that there was something wrong and reported that? Mm-hmm. We didn't see any difference. And then we also had a little under 2,000 patients perform formal cognitive testing. These are tests that are done like on a computer tablet, and you have the patient perform another task. Some of them are little games, other are things where you're checking the reaction time, and we didn't see any difference. But the experts in the field, and I'm not an expert in cognition, but experts in the field say, hey, one of the important ways you assess whether a patient's having trouble with their memory or making plans or organizing their day is to actually ask the patients themselves. So that's what we did here with a 23-question 23 items on a questionnaire at the end of the study, and they themselves did not detect any changes in their cognition.
Is there anything else that you'd like to add concerning this study?
Yeah, well, I have a couple thoughts here to share with the audience. One is that this is yet another piece in the puzzle that gives us some comfort with using PCSK9 inhibitors as class of drugs, in particular evolocumab, Repatha, as it's known. It also is good news for our current strategy, which is to lower LDL cholesterol aggressively in these high-risk patients. So we didn't see any adverse signal even when we looked at the patients who got to very, very low levels compared to those who had more modest reduction in their LDL. It's kind of supportive of other information and other data coming out in this space with other cholesterol-lowering medicines like ezetimibe and with statins. And then people, we should also temper the findings because no one study is perfect and answers all the questions. The patients here were followed on average for 2.2 years, although there are ongoing studies with longer follow-up. We studied this one particular drug, although I mentioned that similar analyses of cognition have been done with other medications that lower cholesterol. And we asked patients, and sometimes patients aren't aware that their memory is slipping away, but as I mentioned, there were other ways we addressed this question within this study, and we didn't see any adverse signals.
This data was published in the Journal of the American College of Cardiology just this month, is that correct?
Yes. And there's much more information involved there, and we have a detailed supplement available online as well.
Do you have a link that we can go to, a quick link, or is it an involved link that our listeners need to go to the website and click on?
You need to go to the website and click on. You can find it under the Journal of American College of Cardiology, or you can use one of the PubMed or Google Scholars to search for this paper.
Great. Dr. Giugliano, thank you so much for joining us here on Health Professional Radio.
Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Robert Giugliano, talking about some data released from the FOURIER study. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.